For our evidence-based project, we will be discussing the opioid epidemic. The opioid epidemic is from the extensive misuse or abuse of opioids. This resulted in a widespread of accidental opioid overdoses. Opioids are typically prescribed for pain. The most common types are oxycodone, hydrocodone, codeine, and morphine. But heroin and fentanyl are two types of illegal drugs that can be bought off the streets. When these drugs are not taken as prescribed or bought off the streets, they can be highly addictive. In 2016 and 2017, data showed that more than 130 people died every day from opioid-related drug overdoses. This was obviously a huge problem, so in 2017, President Trump declared a nationwide public health emergency to combat the opioid crisis. The opioid epidemic may be a nationwide problem, but the prevalence of adolescents misusing or abusing opioids is the main factor contributing to the opioid epidemic.
When it comes to the opioid epidemic, there are some alarming statistics that the people in the United States should be aware of. In 2018, opioids were the leading cause of injury-related deaths in the United States. Heroin and other illicit drugs came in at 55% of deaths related to substance abuse. There are approximately 10.3 million people aged 12 or older that have misused opioids in 2018. Also in 2018, there were 3,152 males and 1,481 females ages 15 to 24 that have died related to opioid overdoses. Just like all other health problems, opioid abuse and addiction comes with risk factors. Those include trauma, mental health problems, family history of addiction or abuse, and poor impulse control. The question with adolescents is, why do they turn to substance abuse? It's because they want to fit in, seem grown up, to rebel against their parents, to experiment, and simply due to peer pressure from other people.
With the alarming statistics about adolescents turning to opioids, this led us to 3 research questions. How does an increased access of opioids affect the adolescent population? In the adolescent population, what is the effect of early prevention strategies on the opioid epidemic? In the adolescent population, what is the effect of early prevention strategies in comparison to prescription drug monitoring programs on the opioid epidemic? The article I chose is called "The Harnessing Online Peer Education HOPE Intervention for Reducing Prescription Drug Abuse, a Qualitative Study." The problem identified in this study is to determine if social media can decrease complications of opioid use in patients with chronic pain. It is important to note that patients with chronic pain are commonly prescribed long-term opioid therapy. Patients living in urban areas and having a lower socioeconomic status increases the risk of becoming addicted to opioids. The HOPE intervention is one way to try to decrease opioid abuse and addiction because it is cost-effective. Treatment for drug addiction includes medication and therapy along with a good support system. By incorporating HOPE, a good support system is readily available and easy to access online. The purpose is to determine if the HOPE intervention would be acceptable to decrease complications related to opioid abuse. For this study, qualitative interviews were used with a descriptive exploratory design. It included a total of 10 participants from the UCLA Health System. 6 were males and 4 were females. All were greater than 18 years old and met the DSM-IV criteria for opioid drug dependence. The goal of the interviews was to understand the importance of social support in opioid addiction, how the participants used social media networking, and whether peer-led support groups would be acceptable for patients at high risk for addiction. The 3 overall themes discussed in this study include: online support is important for decreasing pain, offline support seemed beneficial but had limitations, such as getting to a scheduled meeting on time, and online support groups built with peers would be desirable. The clinical staff interviewed agreed that online peer support groups would be beneficial to their patients. An online support group specifically for patients who abuse opioids should be developed to determine if it can decrease the rates of prescription drug abuse. Patients are more likely to share their experiences with peers who have had similar experiences. Some limitations of this study include the small sample size and selecting participants from only one medical facility.
The article I used is called Features of Prescription Drug Monitoring Programs Associated with Reduced Rates of Prescription Opioid-Related Deaths. The problem of this study is to examine the association between specific features of prescription drug monitoring programs and changes in the risk of prescription opioid-related poisoning over time. In this study, the researchers have found that with the use of opioids, opioid-related poisonings have increased. There were 183,000 opioid-related poisoning deaths, and hospital admissions and emergency visits have significantly increased. To try and prevent more people from abusing opioids, there were system-level interventions put in place like pill mill crackdowns and prescription drug monitoring programs. By implementing these interventions, it gives the provider the opportunity to adequately manage pain with opioids to prevent opioid misuse. There are a total of 49 states that have prescription drug monitoring programs, and each have important features to make the program effective. These features include monitoring all controlled substances, daily reports of dispensed controlled substances, and requirements of the doctor to question before giving a prescription for a controlled substance. Funding for the prescription drug monitoring programs are needed from state and federal governments, which helps assess how effective prescription drug monitoring programs are. For this study, the researchers have used a longitudinal observational study utilizing a natural experiment design, which assesses the association between prescription drug monitoring programs and opioid-related poisoning rates in privately insured adults. Any changes in prescription drug monitoring programs were assessed monthly, and opioid-related poisonings rates were determined from the people who benefited from the prescription drug monitoring programs. Demographic data was collected along with their provider, all facility, and pharmaceutical claims for privately insured adults. The results from this study show that adults with private insurance in states with prescription drug monitoring programs are at an increased exposure risk, but at a decreased risk for opioid-related poisoning due to the increased monitoring of opioids. The researchers discussed how prescription drug monitoring programs that monitor more schedules, require more data from dispensers, and have more robust features show lower rates of opioid-related deaths. Limitations were also discussed. They stated that ICD-9M codes related to drug poisonings have poor sensitivity due to limited drug screens, and data is lacking from demographic information. And because the administrative claims used in this study is generated for reimbursement purposes, are prone to diagnosis misclassification. Overall, to make an impact on the opioid epidemic, continuous changes in prescription drug monitoring programs can help providers identify people who may need substance abuse counseling.
The Behavior Intervention and Disposal of Leftover Opioids, a randomized trial, is another way to minimize the potential for adolescents misusing opioids. The problem was that parents lacked knowledge on proper drug disposal and the significant risks it posed to children and adolescents. The purpose of the study was to determine if providing a behavior disposal method, with or without STOMP, would improve parents' leftover disposal behavior. They hypothesized that by providing a nudge, a take-home disposal packet, it would increase parents' disposal behavior time compared to parents who did not receive a packet. And by using STOMP, it enhances risk information. It will improve disposal behavior and lower plan retention of leftover opioids compared to those who only received routine information. The method that the researchers chose to use is a randomized controlled trial. There were 517 parents randomly assigned to the control group or the nudge group. On days 7 and 14, parents were asked open-ended questions to evaluate the outcomes, prompt disposal or plan retention. The results showed that prompt disposal behavior was higher for parents who received both nudge and stomp. By providing nudge, the disposal packet, it had no effect on plan retention, but the results showed that stomp improved prompt disposal and reduced parents' plan retention rates. Even though nudge had no effect on plan retention, prompt disposal is still considered to be the best risk reduction behavior. This is because opioid storage in the home increases the risk of family members misusing the opioids. Some limitations are acknowledged. For example, the self-reports were not observed, and the study mostly consisted of white, well-educated parents. The study also included some guidelines. The first is to assess parents' past behaviors and their perception of the risk that leftover opioids pose to adolescents. Secondly, educate the parents on the risk and how to address their child's pain in the future without using leftover opioids.
Our proposed solution to our clinical problem is to decrease the access of opioids to adolescents by using drug monitoring programs, proper opioid disposal, and initiating online support groups for counseling. Our selected intervention is to create an educational program for adolescents and their parents to teach ways to prevent opioid abuse. This intervention uses a combination of ideas from our 3 research articles. We will use a webinar educational program to make it easily accessible to the public. The first portion will include education on drug monitoring programs. It will include how these programs help prevent opioid abuse and how to find out if their state currently has one, because not all states participate in this program. Then we will discuss the proper way to dispose of expired prescription opioids. A PDF packet will be linked in for future reference if participants need clarification on proper disposal. Lastly, we will provide an online support group for adolescents or parents who need extra support or clarification. These support groups can be a way for each participant to share their own experiences and thoughts about preventing opioid abuse in adolescents.
By implementing HOPE, prescription drug monitoring programs, and behavioral interventions and disposal of leftover opioid interventions comes with pros and cons within the opioid epidemic. The pros include decreasing the death rates related to overdose, reducing overprescription and doctor shopping because prescribers are now being watched very closely on what and how much they prescribe, which in return prevents the patient from going doctor to doctor to get opioids prescribed to them. It also improves mental health problems because they are now getting more access to rehab and mental health facilities to get the proper treatment they need. The cons include more people are going out buying and selling drugs on the streets. It makes it harder for people who need opioids to get a hold of since prescribers are being closely monitored and they have to be careful on how much they prescribe. Also, online support groups can lack commitment because no one is there to make sure they participate in these support groups. Overall, the opioid epidemic is a growing problem in the United States. By implementing the interventions discussed in our presentation, it can significantly decrease opioid abuse and opioid-related deaths. By making an educational program that targets the adolescent population and their parents, it provides them with a better understanding about HOPE, prescription drug monitoring programs, and opioid disposal, and how it can help prevent opioid abuse. The pros outweigh the cons. If there is a way to decrease opioid abuse and deaths related to overdose, it is proven to be effective.